Hepatology is the branch of medicine that incorporates the study of liver, gallbladder, biliary tree, and pancreas as well as management of their disorders. Although traditionally considered a subspecialty of gastroenterology, rapid expansion has led in some countries to doctors specializing solely on this area, who are called hepatologists. Diseases and complications related to viral hepatitis and alcohol are the main reason for seeking specialist advice. More than 2 billion people have been infected with hepatitis B virus at some point in their life, and approximately 350 million have become persistent carriers. Up to 80% of liver cancers can be attributed to either hepatitis B or hepatitis C virus. In terms of mortality, the former is second only to smoking among known agents causing cancer. With more widespread implementation of vaccination and strict screening before blood transfusion, lower infection rates are expected in the future. In many countries, though, overall alcohol consumption is increasing, and consequently the number of people with cirrhosis and other related complications is commensurately increasing. Scope of speciality: as for many medical specialties, patients are most likely to be referred by family physicians or by physicians from different disciplines. The reasons might be, drug overdose. Paracetamol overdose is common. Gastrointestinal bleeding from portal hypertension related to liver damage, abnormal blood tests suggesting liver disease, enzyme defects leading to bigger liver in children commonly named storage disease of liver, jaundice/hepatitis virus positivity in blood, perhaps discovered on screening blood tests, ascites or swelling of abdomen from fluid accumulation, commonly due to liver disease but can be from other diseases like heart failure. All patients with advanced liver disease, for example cirrhosis, should be under specialist care, to undergo ERCP for diagnosing diseases of biliary tree or their management, fever with other features suggestive of infection involving mentioned organs. Some exotic tropical diseases like hydatid cyst, Kala-Azar or schistosomiasis may be suspected. Microbiologists would be involved as well. Systemic diseases affecting liver and biliary tree, for example hemochromatosis, follow-up of liver transplant, pancreatitis, commonly due to alcohol or gallstone, cancer of above organs. Usually multidisciplinary approach is undertaken with involvement of oncologist and other experts. History. Evidence from autopsies on Egyptian mummies suggest that liver damage from parasitic infection bilharziasis was widespread in the ancient society. It is possible that the Greeks may have been aware of the liver's ability to exponentially duplicate as illustrated by the story of Prometheus. However, knowledge about liver disease in antiquity is questionable. Most of the important advances in the field have been made in the last 50 years. In 400 BC Hippocrates mentioned liver abscess in aphorisms. Roman anatomist Galen thought the liver was the principal organ of the body. He also identified its relationship with the gallbladder and spleen. Around 100 CE Aretius of Cappadocia wrote on jaundice. In medieval period Avicenna noted the importance of urine in diagnosing liver conditions. 1770 French anatomist Antoine Portal noted bleeding due to esophageal varices. 1844 Gabriel Valentin showed pancreatic juices break down food in digestion. 1846 Justus von Liebig discovered pancreatic juice tyrosine. 1862 Austin Flint described the production of stercorin. 1875 Victor Charles Hanot described cirrhotic jaundice and other diseases of liver. In 1958, Moore developed a standard technique for canine orthotopic liver transplantation. The first human liver transplant was performed in 1963 by Dr. Thomas Estarzl on a 3-year-old male afflicted with biliary atresia. After perfecting the technique on canine livers, Baruch S. Blumberg discovered hepatitis B virus in 1966 and developed first vaccine against it 1969. He was awarded the Nobel Prize in Physiology or Medicine 1976. In 1989, investigators from the CDC in Cairo identified the hepatitis C virus, which had previously been known as non-A, non-B hepatitis and could not be detected in the blood supply. Only in 1992 was a blood test created that could detect hepatitis C in donated blood. The word hepatology is from ancient Greek a 1/4 nanowatt euro I plus or minus I or a 1/4 female euro I plus or minus II, meaning liver, and III cubed II plus or minus, meaning study. Disease classification, 1. International Classification of Disease/WHO Classification, Chapter 11, Diseases of the Digestive System, 1, K70 K77 Diseases of Liver, K80 K87 Disorders of Gallbladder, Biliary Tract and Pancreas. 2. MESH, G 2.403776.409.405 Same as gastroenterology, C 6.552 Liver diseases, C 6.130 Biliary tract diseases, C 6.689 Pancreatic diseases, 3 National Library of Medicine Catalog, WI 700 to 740 Liver and biliary tree diseases, WI 800 to 830 Pancreas, also see hepatobiliary diseases, important procedures, endoscopic retrograde cholangiopancreatography, ERCP, transhepatic pancreatocholangiography, TPC, transvagular intrahepatic portosystemic shunt, TIPSS, references.